So you need to put yourself first, especially in medical situations that are fairly urgent, and don't worry about inconveniencing everybody.
Welcome to the Mind Body Podcast. I'm your host, Maria Angelova, and I'm here to challenge everything you have been taught about aging and wellness. This podcast is for those who refuse to accept that growing old means growing unhealthy. Each week, I will bring you dynamic conversations with inspirational guests, sharing practical advice, insights, and motivation to live your life rebelliously as you age with grace and vitality. This is your time to embrace self-care, transformation, and an infectious spirit that says no to the conventional and yes to a vibrant, powerful life. Let's dive in and redefine what it means to live well. Hello, Rebels, and welcome to the Mind Body Podcast, your rebellious podcast with me, your host, Maria, where today we get to talk all things oncology and cancer. We have the privilege of having here a very special guest, Dr. Tiffany Troso-Sandoval, who is a medical oncologist and who supports women through their oncology journey so that they can travel the journey with clarity, calm, and confidence. Welcome, Dr. Troso. It is such a pleasure to have you here.
Thank you so much for having me, Maria. This is really quite a treat. I really enjoy speaking with you off camera, so I can't wait to see what kind of conversation we have here.
Yes, you deal with something that it's quite the journey, right? For, unfortunately, way too many people nowadays. You know that I have a personal history with cancer. My dad passed away from cancer. So unfortunately, I know what it is to walk by somebody who is going through that experience. And I'm so excited that you're here because you bring light and support and empathy to those who are going through that journey. And I think, again, as somebody who has watched somebody go through that journey, I think that goes such a long way of having that support and that heart-driven energy. And before we dive into all that, let's get to know Dr. Tiffany, Dr. Troso. Like, give us 3 words that tell us who are you, and give us a little of a backstory behind each word.
Oh boy. Okay, so my number one word is passion. I'm passionate about everything I do, and I am completely dedicated to my mission. And I am full of life. I think would be it's not one word, but it's a phrase. So I do everything with gusto. I don't do anything halfway, and I have found my passion early on in helping people and becoming an oncologist and becoming a physician. And by this new venture where I'm now building my own company that is providing education, second opinions for patients, I can work with them on a level that I wasn't able to do earlier on when I was in academic medicine, where we were turning patients every 20 minutes or so. So I'm really excited about my new mission and my new direction with helping patients in the oncology space.
And let's start talking about just right there. You go to the office, you're given a diagnosis. And I'll tell you, I've spoken to a lot of physicians who say they call it moral injury. And they're like, I go in, I give the diagnosis, and I have 5 minutes to walk in and walk out. And then I leave the patient with this devastating news in some cases. And I feel bad because I don't have the time. I have to rush to the next patient. So what got you to get out of, the job that you knew, your comfort zone, and start something so innovative and different, something that comes from a place of passion and heart-driven energy to continue supporting those people in a new, more innovative, and I would say more fuller and holistic way? Tell us about that, because I think sometimes we don't see the physician's part of that journey.
Yeah, sure. Yeah, as you can imagine, the phrase used to be every room you went into is a different world, right? And so every patient and family member comes to these appointments with their own set of circumstances, their own family history, life, issues. And so the short medical oncology visit in particular needs to really cover all the social aspects, psychoeconomic aspects of it, and the medical aspects, right? So I have X amount of time to come in and explain your diagnosis to you, explain your medical treatment options, as well as get to know you and what's important to you and how you want to be cared for. And it was almost impossible to do that in the time allotted. And then don't forget, on the back end, there's all the charting that needs to be done, all the ordering that needs to be done. Most of it was still all fell on the doctor to do. And so by breaking free of the traditional model, I'm really able to meet people where they are, get to know them more deeply, and really understand their values, and provide care within those boundaries. And so, every room that you'd walk into, you'd have one room that there'd be, 3 children, and don't tell mom she has cancer, but yet I'm supposed to prevent, help treat them and give them, treatment recommendations, but without mentioning that I'm treating cancer. Or, you walk into the next room and the patient doesn't have enough money, perhaps, to pay for their anti-nausea medications because they don't have a prescription plan. And each room that you walk, or the next room you walk into, the patient, has been on treatment for 8 years and doesn't want to go through treatment anymore. And so you're talking to them about end of life and about keeping them comfortable and that sort of thing. And then you walk into the next room and the patient's mad because they were waiting for 15 minutes for you. And, they have real and concerning issues, but maybe not as dire as the room before that you were in. And each time you walk out of the room into the hallway, before you go back into the next room, you almost have to reset, like a complete, you got to start fresh, bring the same energy, bring the same, passion with you. And it's an exhausting physically and emotionally to be an oncologist. That being said, we owe it to the patients. I got into this medicine to help people and to really, not only, do the best that we can to cure their cancer, but also to help them along the way, what I call the journey. Some people don't like that word because when you have cancer, it's not really a clear beginning and end. And sometimes you feel like you're always on the journey. But I don't know how better to explain what goes on, because once you have a diagnosis of cancer, it's always somewhat with you. And you're treating it or managing it, for the rest of your life, more or less. So let me tell you a story. So I had a patient that came in and she spoke pretty good English. They were originally, I think, from India or Pakistan. And I'm sorry, I don't remember where, somewhere over there. And she didn't speak English very well. And her husband came with her and her daughter. And it was a new consult, and she had been seen somewhere else, and they were confused about what their treatment options were going to be. And they wanted to transfer care to Memorial Sloan Kettering, where I worked. And the patient's husband comes in with this big shopping bag of like thousands of papers. And so in my consultation, I start talking to him about, well, do you have the copy of your last CAT scan? Because I didn't get that with my record. And he opens up the bag and he's rustling through it and the papers are flying and he's handing them to his daughter, and they're arguing because they're all stressed out because he's not organized and they don't know where the papers are. And I said, we'll get the CAT scan report for you. And when I finished the consultation, the patient needed some hydration. She hadn't been eating or drinking very well. So I put them back into the chemo room, started an IV on her, started getting her fluids. I sent the husband and the daughter to Staples. I said, get me a binder. Get me page protectors, get me binder dividers, and a 3-hole punch. Goes off, buys the things. The front desk calls me. Mr. So-and-so's back with his things, gives them to me. I take the shopping bag. And during my lunch, where I'm, kind of eating a turkey sandwich, my nurse and I go into my back office and we sort and flip through all the papers, sort them, hole punch them, organize them all, put them in the binder. It took me 20 minutes because I know what I'm looking at, right? And so I sort records all day long. And I went back to the chemotherapy room and I handed them this binder. And the husband honestly started to cry.
I'm about to start crying, Dr.
I mean, he couldn't believe that somebody cared enough to help him, not just on the medical side, but help him with his lack of organization, with his, inability to be controlling over anything that was going on in this, because you're helpless, right? And when you get thrust into this. So anyway, it's just one little vignette. I walked away from that thinking, I'm so happy I was able to help many people today with their treatment of their cancer. But that was my most proud moment because I touched him at a deeper level. And I thought that really brought meaning to me in terms of what kind of doctor going forward I want it to be. Now, obviously, if I'm seeing 25 patients a day, I can't be organizing everybody's records in the back room. I only get, you know,
only have
one
lunch hour.
I only have one turkey sandwich in 20 minutes. But it's just one example of, the kind of care that I think people deserve and that they need, where you're meeting them where they are, you find what they need and you help them. So that's just one little vignette. So,
that's some of the feedback. Now, I don't work with people who are dealing with terminal injury, so to say, kind of like what you're dealing with, but they do deal with a lot of people with pain. And pain can affect you in many ways, psychologically, emotionally, like the way it impacts your energy.
Sure.
And I will tell you, my practice is very much concierge-like, because you don't just come for your session and leave, and I don't see you till next week. I follow up with you if there is pain, how you're doing. Do I need to refer you to somebody? It's a very comprehensive approach to how you're feeling. And the one feedback that I get from clients is exactly that. I mean, yes, they appreciate the work that we do, but what they also appreciate is they're like, wow, we have never gotten this kind of support and that kind of care. And it's genuine care, right? I don't do it because I have to do it and put a check mark. It's truly because I care, and they feel so supported. And that's where the trust starts happening. And I can only imagine if somebody who is dealing with something like cancer, I mean, like you said, you feel like everything is out of control and you're stressed out, and the little things such as putting, or finding the one piece of paper that you need with the last test suddenly becomes so super stressful. And knowing that you have a physician on the other side who cares about that, it's a big deal. It's a really big deal. So when you decided to make this big move, I mean, you were a very well-established physician into what you did. And you chose to take the brave move of saying, you know what, I want to provide even better care for my patients. In the work that you do now, because you have more time for your patients, what do you think are the biggest opportunities for those listeners who perhaps have a loved one who is dealing with cancer, or perhaps they're dealing with cancer? What are the things that you find provide that extra support, aside from the treatment and the medication, that patients benefit from having extra time with you?
Oh, it's endless. I have a whole course that I've created and a book that I'm putting out that sort of goes through my methods, but I have a method in which I try to meet the patients again where they are, and I help them to prepare for their consultations, and that really involves their mindset as well as education, right? So if you don't know, and you don't know what you don't know, anything about your disease or about which scans to be getting, or what's the difference between immunology, immunotherapy and targeted therapy or chemotherapy, it makes it very hard to participate in your care. And then it all becomes overwhelming. So a lot of what I do is education. And I'm blessed that I have the ability to take these complex medical issues and questions and concerns and bring them down to a way that people can understand what I'm talking about. And so, I use lots of analogies and comparisons and real life types of situations so people can really understand what I'm talking about. So there's that. And that's an enormous component of it, just the education itself. When I go over somebody's pathology report with them in my new business, they walk away, even though they've had the diagnosis, say, for a year, and 3 doctors have already reviewed their past with them, they walk away with an understanding completely at a different level than they had before. And that helps them make decisions, and it helps them feel more supported and more confident in talking to their doctors because they understand better, right?
They can ask the right questions, right?
They ask the right questions, and I help provide them the right questions. And if the patient would like me to, I'm more than happy to converse with their treating doctor, because as a second opinion and as a concierge, I have the luxury of being removed from the system. I can be impartial, and I'm collaborative. So I would never call another doctor and be like, "You did this wrong," or "I don't do it." The conversation goes like, "I understand the choice that you made and why you did this chemotherapy. Could you tell me a little bit about why you made this decision?" And I might say, "Well, in my experience, I tend to like to do it this way, and this is why." So it's like it's a collaborative, collegial conversation. And I have to say, it's very rare that I completely disagree with another physician. I mean, most people that are out there, for better or worse, know what they're doing. I think that what most people in academic or community medicine are missing is time and the ability to really support and educate their patients. And so I can provide that additional layer of support for the patient and be supportive of the actual treating doctor, which is really a wonderful place to sit.
And I have to agree with that, because again, working with some of my clients who have more complicated issues or are post-surgery or, big injury or anything like that, it's great to have somebody on the other side who you say, hey, this is what I'm seeing. Like, is this what you see? Do you agree that this is what we should be working on together? Because I don't want to be working on A, they're working on B, and we're working against each other, right?
Absolutely.
And then a lot of times, sometimes they have, let's say, impingement on nerves or things like that. If I have to pass the information by their neurologist, I'm like, these are the moves that we're doing. Is this safe for us to do? Do you want us to continue doing this? And I think having that collaboration is great for all the parties involved, but also for that client and the patient, because they feel like, oh, you're talking to my physical therapist, you're talking to my neurologist, we're doing the work. And I know that everybody is working for my benefit and for my highest good, versus everybody's in a silo, which is unfortunately, I think, happens a lot today. And again, the world of oncology is so broad, and there is so much that goes into treatment.
No, it's true. It's true.
Hey Rebels, I want to take a quick moment to share something super exciting with you. If you've been feeling stuck, disconnected, or just know there is more to life than what you're experiencing, I have something special for you. I have created a powerful 6-step video series called Unleash Your Potential, an introduction to the Angelova method. As a valued Mind-Body podcast listener, the series is my gift to you. In this series, I will guide you through the core elements of the Angelova method, a unique approach that integrates movement, mindset, and mastery to help you align your body, mind, and life. You will learn practical techniques to improve your alignment, boost your core strength, and connect deeply to your inner self. Whether you're looking to enhance your physical health, gain mental clarity, or simply live more fully, these videos are designed to get you started on the path to your most vibrant self. And the best part? It's completely free. So if you're ready to break through barriers and unleash your full potential, head over to mindbodyexpert.com and get started today. Let's take this journey together, because you, my rebel, deserve nothing less than the extraordinary.
I have another little scenario I'd love to tell you about, which is part of what I do with my patient, because I mentioned the mindset part. And so I want to start with another little story. And this is representative. This is not even necessarily a specific story, because I have thousands of them. Patient comes in, and she's 65 years old, and she has a 30-year-old daughter, and her daughter has, children. She has a daughter. Daughter has a daughter, right? So, and the granddaughter does ballet after school every day, and so the patient's daughter herself works. Okay, so my patient comes to see me. We go through her treatment recommendations. I tell her about the side effects and tell her what she needs to do. I teach her how to journal her side effects and symptoms and how to communicate best with us in the office. She goes home. She starts her medicine. She's taking an oral chemotherapy pill, and she ends up with severe diarrhea. She must have, either she took it wrong or she has something else going on. Severe diarrhea. Doesn't want to call her daughter, because she doesn't want to bother her, because the daughter's busy with her own job, and her daughter, who's doing all this ballet and very busy. So my patient doesn't call anybody. She doesn't want to bother anybody. Ends up dehydrated, falls, breaks her hip, ends up in the hospital. Now who's inconvenienced, right? Now the patient she's put herself back weeks now, because now she has to have her hip repaired. She can't be getting her treatments. We're not fighting her cancer right now. And her daughter is now sitting by her bedside in the hospital, right? And the granddaughter is being watched by a friend. Now, what happened here, and why did this happen? The problem is, in our society, that women are the caretakers, and they always feel like they have to be the strong one. They're the rock. They don't want to inconvenience anybody else, and they don't put themselves first. So when I finally got this patient back in the office, I took my prescription pad, and I wrote on it, "You must come first." And I ripped it off and I said, "Now hang this on your refrigerator and understand what that means." What that means is that until you take care of yourself, you're not helping anybody, including yourself. So you need to put yourself first, especially in medical situations that are fairly urgent, and don't worry about inconveniencing everybody. And it's a hard mental shift for many women to make, because that's not how we're sort of raised.
Yep.
And, I think it's a very important mindset shift that needs to be made. And so I actually work also with the patient's caregivers as well, in terms of helping them figure out how to help the patient. So that's just, one scenario, but I can tell you so many, the patient that doesn't want to get her PET scan on Friday because she's got a big report due at work and they can't deal without her. And so she's got to get the report done, or, and it goes on and on and on. So, helping patients to prioritize their care is, believe it or not, especially with women, extremely important.
And, I see this all the time. And I do think you're right that I don't know what it is about women, probably because we are the nurturers, right? The caregivers. So take care of the kids, take care of the parents, take care of the husband, take care of the house, take care of the work. And then when you have energy, take care of yourself. And in situations like when you're dealing with disease, I mean, ideally before that, but that is like critical time. That is your body asking you for, please take care of me, right?
Yep. Yeah.
And it's an uncomfortable mindset. I just spoke to a client yesterday, and she's making a job shift. And she was worried about the job she's leaving, about how they're going to react to it.
Right.
Okay, it's great that you're concerned about them and respect them. But like ultimately, you're growing and you're stepping into a position that's offering you better opportunities. You can still live with gratitude, but make yourself first. That is so important. And I would love for people to hear this message and not wait till the diagnosis of whatever that diagnosis is, right? But to take that message like so seriously, coming from a doctor, you guys. This is coming from an oncologist, doctor who deals with serious disease.
Yeah.
it's mindset piece is big. And Dr. Troso, tell us a little bit about, because I work with the mind and the body. Tell us a little bit more about how important is the emotional state during the journey. I know you said people don't like to call it journey, but during the duration of that you're going through treatments and evaluations and so forth.
Sure. I one other analogy from what we were just talking about, I just want to mention. This is so basic and straightforward, but when you're on an airplane and they tell you to put the oxygen drops, you put your own mask on first, right? And then you help everybody else. You can't help anyone if you're not well. And the emotional component that you're talking about right now is part of that as well. And, prioritizing yourself is part of your emotional fortitude to withstand the treatments. And the thing it's hard because, every patient comes into the disease state with the mindset that they have developed over time, right? And sometimes in acute situations, whatever your idiosyncrasy is, tends to exaggerate somewhat. But the thing that I try and help patients to learn and understand is that they don't want things to happen to them. They want to be taking the first step, right? So you're going to be proactive in your treatment. You're going to look at the glass half full and look at what helps you. What's going to help you get better? What is going to help you do as well and feel as well as you can during this journey? And, another little tiny analogy from being in clinic, for example, the patient that comes in, not one particular patient, I just, in general, the patient that gets bothered by the little things, like their appointment time was changed and they didn't call her or she didn't see it on the portal. It's all really inconvenient. And I can attest to that personally as a patient, right? I get it. But if you let that overturn your day and or your interaction with the physician, when you're there to really care about yourself, to take care of yourself, you're doing yourself a disservice. And it's so easy for me to say, standing here up on the mountaintop, right? Well, let the little things go. But sometimes it's actually really important, because I think some patients get lost in they didn't like how somebody spoke to them, or they, and it happens in regular life too, right? When you're rushing to work and you stop at Starbucks and like get your coffee wrong and you don't realize it. I mean, that could ruin my whole day. But then I stop and I take a deep breath and I think, this is small beans. This is not what I'm here for today. So,
I love this because one of the things that I teach my clients to ask is this worth my energy?
yes,
Our time, energy, and health are our most precious assets. And you're absolutely right, because what you're describing, going down the rabbit hole, right? Because now they delayed my appointment, and now all of a sudden, they delayed it last week too, and now I don't like this, and now somebody, right? And it just becomes this massive thing that you're so focused on, not the thing that you're there for. Right. And again, that comes from, with all the respect, because your mind is racing, you're all of probably what ifs are going, but maintaining that balance in your brain and just finding little ways to return to the present moment and to be intentional and focused. Yep. And I have found that I'll tell you, I have a little thing with my husband and I just take a breath and go, is this worth my energy? And 99% of the time, the answer is absolutely not, right? So what we're talking about here is being reactive versus being responsive. And especially when we're going through stressful situation, choosing to be responsive goes such a long way into how you. Yeah. I totally agree with you. Dr. Troso, what would be, if anybody right now listening is either dealing with cancer or is a caregiver for somebody in cancer, and there are two different situations, what would be your advice, one piece of advice for them?
So somebody that's dealing with cancer, would be to make sure, let's see, that's so broad. So broad. Here's an idea. Here's one idea that I haven't shared, on a podcast. So this is a fresh one for you. So patients that are especially newly diagnosed or are now recurrent disease or what have you, there's been an advancement and they have to go on treatment again. I think one of the most important things that they can do is sit down and make a schedule. You can actually use just a, scheduling app, or you could use a calendar and make a schedule of all the things that you are required to do in the next 30 days. So you got to pick up your daughter on Wednesdays at 3:30. You have to take the dog to the vet on Friday. You need to make dinner every day. You need to go to the supermarket, whatever that is. You're going to make a mind dump of every little activity that you as a woman are, going through, right? And that you're responsible for. I have to make sure that mom's pill box is filled and, whatever it is, make your list. Then I want you to sit down and think of who are the people that you want to be part of your care support team. Mm-hmm. So maybe it's my sister, maybe it's my best friend, maybe it's a clergy, what have you. Whatever you decide, you come up with 3 to 5 people that are going to be part of your support
system. Mm-hmm.
And then you have to decide who can do what. Because people, your loved ones, your caregivers, your support system want to help you. And you need to learn how to accept that help. Mm-hmm. And it's usually best if you help guide them in what's helpful, right? So if your sister is, she's not great with details in terms of, you don't want her to come to the appointments and take the notes, but, your brother is really good at that. Brother comes with you to the appointments. Your sister can pick up the kid, can, make lasagnas on Wednesday so that you have something to eat when you get home from chemotherapy or what have you. Anyway, you get the idea. And you have to think through the process, because not everybody is good at everything. But if you don't tell anybody what you want or what you need, then you get 14 Afghan sweaters, or you get no food, but, people dropping off flowers or something. And because people care and they want to help, right?
People are well intentional, but it's great if you can direct. I think that is such brilliant advice. And it's, you bring up another mindset piece, asking for help, right? Because many of us are not used to asking for help.
Right.
Yeah, I love that. That is such brilliant advice. And how about for the caregivers? If you're on the side of supporting somebody going through cancer?
Ask how I can help. Sometimes if what a lot of patients will tell me is that, they're a friend, a really good friend will call and say, listen, call me if you need anything. They're never going to call. The patient's not going to call them for that. Mm-hmm. Unless they learn the mindset that I was just telling them. But what is helpful is if, my friend had cancer and I know she's going for treatments on Tuesdays and Fridays, I can proactively offer, do you want me to pick up your daughter from school on Tuesdays and Fridays? Hey, do you mind if I drop off some food on Monday so that you have it when you get home for Tuesday night? Get involved with the friend, the patient, the loved one, what have you, so that you kind of understand, so that even if they're not directing you, you can provide actually concrete offers. And maybe even if she says no, she doesn't want the food, you can drop it off anyway. Or gift cards, right? You can always organize gift cards so that they can pick up, order food from a local facility. But anyway, just try practical, helpful things is always good, instead of just like the blanket, like, oh, call me if you need me. I'm happy to help.
Yeah.
Nobody takes you up on that, really. So
yeah. Okay. That's brilliant. Okay. We can wrap up without me asking you, what's your definition of rebellious, Dr. Troso?
Ooh, rebellious is somebody who is breaking the norm, who is walking away from the traditional way of managing medicine in general and healthcare in the broad sense. I think that I am rebellious in that I walked away from a very big academic medical center after 25 years, thousands of patients, to follow my dream of helping patients at the level that I want to help them.
Congratulations on that.
Yeah.
And I definitely think you're a rebel, which is why you're here on the Rebellious podcast, right? Dr. Troso, for those people who are listening and they're like, who is this woman? How do I get in touch with her? I support that she's offering. What's the best way for people to get in touch with you?
So one very easy way that I've set up, and we could put it in the show notes, is the phone. You could text the word cancer to this phone number, 516-271-4114. One more time, 516-271-4114, and text the word cancer. And I will send you a document, a PDF that has all of the most important questions to ask your oncologist. That's a little deeper than what you normally would find on the internet, so to speak, if you were to Google that. And that way you'll also get on my email list and I will be able to contact you. I also have a website, winningthecancerjourney.com.
Great. And we're going to include all of that into the show notes. We're going to include the phone number with the directions, the website, so that people can, again, reach out to you, stay connected with you. And I thank you so much for being here with us.
It's such a pleasure.
And I am so glad that there are doctors like you who are choosing the courageous decisions and stepping away from comfort so that they can provide better and more wholesome support for patients. Personally, thank you. And I look forward to staying connected and supporting many people through their journeys. Rebels, please share this episode. Super important and practical information included. Like, share, subscribe. Do make sure that you connect with Dr. Troso. Do make sure that you ask your questions if you have any, because chances are, if you have a question, somebody else does as well.
Sure.
And all of that said, Dr. Troso, thank you so much for being here with us today. Rebels, thank you for listening. And do not forget to stay rebellious. We'll see you next.
Bye. Thank you.
Thank you for joining us on the Mind Body Podcast, where we explore the power of living authentically and rebelliously. If you enjoyed today's episode, don't forget to subscribe, leave a review, and share it with a fellow rebellious soul who would love to hear what we share as much as you do. Stay strong, stay calm, and most importantly, stay rebellious. Until next time, rebellious souls, keep living fully. Your journey is just beginning.